Hello, good evening. Gary Gedall, psychologist, psychotherapist, here on my terrace here, Lausanne, at last. For those that saw me yesterday, I was driving home, so I did the YouTube live from the car, which was fun. And people say I shouldn't have done it, but I feel I was quite safe, so there's no real problem there. Tonight I'm going to talk about what I call the many faces of bulimia. But first, as this is the end of the YouTube Live 70-day challenge, as usual, I'll tell you a bit about my life and how things are going and where I'm at, etc. And so yesterday, as I say, for those that were watching, I did YouTube Live driving up from Italy. It was a 9-10 hour drive. So I didn't want to stop for an hour to do the YouTube, so I did it while I was driving, and everything was fine. I'm able to talk and to drive at the same time. Most people do anyway. It's just the fact that it was a YouTube live as opposed to talking to somebody. So that was fine. I arrived home reasonably early. That means I had a few hours sleep. I went to see the doctor this morning, my generalist, to see how I'm doing. I'm still alive. Hooray! After that, I had a day basically of consultations as usual. Finished my consultations, came home, and here I am with your YouTube live. And this is basically the last YouTube live of the series. It's a 70-day challenge. 70-day challenge finishes on Saturday. Friday I don't do a YouTube. It's always been my day off, so that's like that. I hope to be able to do something for Saturday and maybe even do a meditation for guided meditation, hypnosis for Sunday. I'll see how I feel. It's part of my holiday, so I don't know if I'll get to do that. But then after that, that's the end, and I'll talk about that at the end, and we'll see how that goes. So today, the many faces of bulimia. So I was talking last week to one of my patients, and we talked about bulimia, and I was saying to her, because most bulimics are women. I was at the Bulimia Anorexia Association general meeting about 2-3 weeks ago, and they had a quiz, and I seem vaguely to remember them saying that it's about 7-1, 7 women to 1 man that have eating disorders. Not just bulimia, there are men that are anorexic as well. It does exist. Not that many, but it's a real population that maybe at some point needs to have much more attention. And so I was talking about bulimia, and I was saying that basically bulimia is a general description, and it doesn't really cover everybody. And there are different types of bulimia, and there's also things that could enter into considered to be bulimia, which is not bulimia. And I started to talk about that, and I thought this might be an interesting subject for you to be aware of. So first of all, in the medical diagnosis, bulimia is basically eating a large quantity of food in a short time and then finding some way to purge, which is generally throwing up, but sometimes it's taking laxatives. And so those are the two main ways, but my definition of bulimia is much wider than that. It's eating a quantity of food, not necessarily a huge quantity in the short term. That's something that can be very much discussed. And then finding a way to compensate for the amount of food that you have eaten. And when you get to, as I say, it's very, very wide what could be considered bulimia or not. One of my first experiences or contact with it was my mother telling me that she would go and have meals with my father. Had a very close relationship with his bank manager, which I'm sure was not appropriate. And they would go out to eat together in very posh restaurants, which was usually the bank manager paying for it. And they would bring their wives. So my mother would go with my father, and the bank manager's wife would go with him. And they would have these beautiful meals, and the bank manager's wife would really enjoy her food. And then once by chance, my mother sort of followed her into the bathroom after the meal, and she heard bank manager's wife throwing up. And then she realized that that's how she kept her thin figure. She would eat and then she would throw up. Now, That is not a psychological problem. It's a, if you like, it's a social problem. The fact that women are supposed to be thin, and if you like to eat and you're supposed to be thin, then you need to do something to keep being thin. It's not a psychological problem, it's a social problem. But when you actually get to psychological and psychiatric problems, the next group of problems are personality disorders. And people who are borderline, people with personality disorders, are sometimes also bulimic. That is something that fits into the personality disorder, just like self-harm is also a sign of personality disorder. Chronic depression and things like that are linked to the personality disorder. They're not a trouble by itself. It's no good trying to deal with any of those things in the periphery because the core issues are much deeper than that, much more complicated than that. And when you deal with the core issues, then the other things pass. And that is the basic message that you'll get all the way through this reflection, this discussion, is that you should not try and treat a problem through the symptoms. Now, there's a lot of behavioral, cognitive and behavioral cognitive, CB, cognitive behavioral therapy, CBT. Get confused with the French, get confused with everything. So, cognitive behavioral therapy that often has this idea to deal with the symptoms. You deal with the symptoms, then the cause sort of withers and dies. I'm very concerned about that as an approach. I've noticed, I mean, I've started to get interested in this subject 20, 25 years ago. So it's something that for me is a long time ago. And I think therapy has advanced an awful lot in these years. But at the beginning, there was very few attitudes. It was all like, this is an eating disorder. This is bulimia. You should treat it this way because it's bulimia. And it's always concerned me because in my clinic, I have very often seen people that have bulimia, but are very different. So the first case I want to talk about is a woman that came to Switzerland as a young child who comes from a very, very good family and a very strict family that maybe would be stricter than we would find in Switzerland, and very much kept her blocked. She was quite intelligent, so the family expected her to focus on her studies, and they were quite strict with her. And she wasn't allowed to talk back. She talked back, she would get a slap. So she learned very, very quickly that you swallow your words and you swallow your anger because if you express it, it's going to be bad. And then what happened is that she came eventually to Switzerland and she married a very nice Swiss guy. And all seemed well until the Swiss guy's family, his sisters would come and his parents would come. And because she was not Swiss, they sort of treated her sort of like a servant. I mean, it was very difficult because she came from a very good family in her own country, so she was used to having servants. She wasn't used to be treated like a servant, but because she was trained, educated to shut up and accept what people told her to do, and she had the whole of this guy's family that would come from time to time, and she would cook for them and clean for them and do all these things for her, and it just wasn't her thing, and she hated it, but she couldn't do anything about it. And what happened is she became bulimic. She started, whenever she was stressed, she would eat and eat and eat and eat, and then she would throw up. Quite classic bulimia based on anger. She was swallowing her anger, she was swallowing her words, and that's what happened. Now, which is quite classic with bulimic, especially the ones that throw up, also the ones that take laxative, but to a slightly lesser degree, is that when they actually go to the toilet to throw up or to poop, they feel guilty. They feel dirty. They've done something that's not acceptable and they feel bad about it. So that is, if you like, classic bulimia. Somebody that has an anger issue, eats too much, eats a lot in a very short space of time, compensates with throwing up or laxatives and feels bad about it. However, you can have things totally different. I had a patient once who was very, very abused as a child, also an immigrant, And again, she couldn't tell anybody about it because every time she opened her mouth to say something about it, the parents said, "Oh no, she's just making things up. She's fantasy. She's this, that, the other." Nobody believed her. So talking about what happened never brought her any benefit. So she just stopped talking about it and she just kept this inside. And she was someone fairly depressed most of her life, that was a bit of a victim and felt quite abused by most things in life. And then something happened. She got pregnant. It was fine. She was married. She got pregnant. First few weeks of pregnancy, her first trimester, she goes to toilet. She throws up, just like most other women that are pregnant in the world. What was different was that she suddenly felt lighter. She felt cleansed. She felt that she gave out some of this poison of emotions that she'd been holding on all her life. And it felt good. And so, quite different than most pregnant women, she would look forward to the moments that she would go and throw up, because she would wash herself and wash her mouth and wash everything out, and she would feel light and she would feel relieved. After the first trimester, she stopped throwing up, and because she had a baby inside her, then she stopped throwing up because it wasn't right, it wasn't appropriate. But what she actually found was after the baby was 2, 3 months old, she had this need again to throw up. And so she did. She would eat a lot. She would eat a lot because you throw up and you don't eat a lot, then it's very painful and it's difficult. But she would eat things like ice cream that would fill herself, fill her stomach, but would be easy to throw up, needs to get rid of. And then she had that beautiful moment of feeling cleansed and lighter, which is totally different. As you can see, you have two situations that are so totally different that although it's the same diagnosis, eat a lot and throw up, or eat a lot and find some sort of compensation to not gain weight. On the surface, it's the same problem, but it's not at all the same problem, because this woman was dealing with huge childhood trauma. And what did we do? We worked on her trauma. I did not touch in any way her eating disorder. I say, as long as you need that, then do it. Just try and remember the feeling that you would have when you throw up, that feeling of getting out and getting things. And with hypnosis, I sort of invited that throwing up experience, but using words. And so she transformed that experience of throwing up into spitting out, vomiting up all the words of anger and frustration and hurt and not being heard. And it lasted quite a long time. It wasn't a quick therapy. But each layer that we went through, she found that she was less and less in need to go and throw up. And then after a period of time, it just disappeared. Why? Because we had liberated her from the poison that was constantly poisoning her life, and she became much more dynamic and much more open and much lighter and much clearer, and were able to defend herself. All these things were benefits that came from working with the trauma. Now, what about my the wife of my patient, and her husband and his sisters and his parents? What do we do about them? Well, that's a totally different situation, because she was treated, as I said, like a servant. He felt uncomfortable, but he didn't know how to put his parents and his sisters in place, because he was the youngest, and his sisters had always sort of expected him to support them. And when he was married, he expected, obviously, for his wife to support them. They were all little princesses. And so I had him in and we talked about it. And I said, do you realize how much your wife is suffering from this? And he says, yeah, but I don't want to have huge rows with my family. I don't want to have this. I said, you're going to have to deal with this, because she's not doing well. And if I remember rightly, because it's quite a lot of years ago, I think she got to the point, I think so, I don't put my hand in the fire for this, but I think she got to the point that says, if you don't talk to your family, I'm going to have to leave. I think she said that. I think she said that I cannot cope with this forever. I'm feeling very bad. I'm getting depressed. I think she used the word suicidal. I don't remember. Don't quote me on this. But she really said, you need to do this. And he said, but I don't want my sisters to suffer. And it's like, what are you missing, mate? You've married someone the most wonderful person, because she was a really, really nice person, generous and kind and intelligent. So you marry this woman, you don't want your sisters to suffer. Your wife could do who knows what, and she might even leave you. I mean, are you going to do something or not? And so eventually he dared to put his sisters into place. His parents were not too bad, but his parents supported the sisters. And because the parents supported the sisters, it was really blocked against him. But the moment he started to tell his sisters that she's not your servant, I expect you to invite us to your home and for you to cook and you to invite us. And the sisters were shocked, totally shocked. What do you mean? We invite her. You always invite us. You're the son. You're supposed to do these things. You're the man. And eventually he just said, no, until you invite us, you're not coming back in the house. He got really, really clear. And it worked. Eventually the sisters sort of understood that this woman was not their servant, that she actually came from a good family, she was well educated, and she wouldn't cope. And eventually, because you ought to remember, with families, so it's complicated for her to attack the sisters. It's not really her job because she's not their sister, and it's his job as the husband and the brother. But eventually, she started to talk back on them. Eventually, she said, "Don't talk to me like that. I'm not here for that," and things like that. And eventually, things got into a balance. There was a crisis, and it stopped. And eventually, they sort of refound a new balance where the sisters were a lot less abusive. They still had this sort of like narky sort of attitude, but a lot less abusive. What happened? What happened was she stopped having these bulimia crises. She started to express, first of all, to me, and eventually, and then to her husband, and then eventually to the sisters and a bit to the parents, her reality, her anger, her frustration, and it came out. And it was a beautiful thing, even though it was painful in the family structure. It was a beautiful thing to see this woman take back her power in life. And because she took back her power, then this bulimic crisis stopped, but not totally. Because there were still the moments that the parents would come, her parents and his parents would come, and she couldn't put them in that place. That she couldn't do. And even with her own parents, she had difficulty to keep a structure. And they weren't particularly abusive, but they just had this attitude that she wasn't good enough and she needs to try harder. And there's good crush her a little bit emotionally and psychologically. And she defended herself a bit, but she couldn't, not totally. And what did she do? She went back to eating more of these things. It was usually sweet things. To begin with, it was more pasta and quantity, because she needed to swallow her anger and to push it down and hold it down. Then after a while, when she sort of got over that, it was basically sweet things, so that she dealt with her feeling of negativity and depression. She did express herself, so it wasn't exactly pushing everything down. It was sort of like to sweeten it a bit, so it became less painful. But you see that there are different ways of dealing with things because the situation is different. For instance, I had a patient that was an ex-anorexic. So, and that's something I'll talk about, anorexia, bulimia, in a moment. But she did not have this hyperphagy. She did not have this eating a huge quantity in a short space of time. That wasn't her stuff, wasn't her thing. Her thing was a ritual. And several nights a week, because it was quite a lot to begin with, several nights a week, she would buy lots of quite expensive, not very small quantities, but very expensive foods. And she would set them on this table, and she'd put a candle, and she'd make something really, really nice. She would treat herself well. And then she would eat and eat and eat and eat and eat. And she was a very small frame. So it didn't take very much for her to get overstuffed, overfull. And then she'd go and throw up. And that was her ritual. And she did that several nights a week. But it was totally different. Because what was she doing? She was trying to compensate for not feeling loved. She was alone. She was, I think she was divorced. And she had complicated relationship with her parents. So she was a bit alone in life, alone in the world. And what she wanted to do was to feel better about herself and to say, I deserve to be looked after. I deserve to be loved. I deserve to be cared for. I deserve to be fed these beautiful things. And so that was the logic. The logic was to fill up an emotional gap, an emotional problem that she had, that she couldn't find another way to fill it up with relationships. And so that's what she did. But because she was an ancient anorexic, then staying thin was also important. And then we come to something else, another group, bulimia anorexia. And bulimia anorexia, from my experience, often follows on from treated anorexics. And this is the problem when you treat the symptoms and not the cause. Because treated anorexics, often they go to centers, they get sort of brainwashed, all these sort of things, that they have to eat. Now, it's obvious if you don't eat, you die. And they get that message. They get the message that if your weight goes below this amount, you'll end up in hospital, we'll force feed you, you lose your power, you lose your autonomy, and it's a bad thing. And every time you go below this weight, that's what's going to happen. So they integrate the concept. They realize that below a BMI, let's say the measure of weight and height, the body mass index. I remember things eventually. If the BMI is below, I think it's about 16. That's usually the 15 or 16. That's usually the moment they take people in hospital. And sort of like between 16 and 18, it's sort of acceptable, but it's not good. So what happens is they integrate the fact they need to keep their body weight up, or the BMI, the body mass index, up to a certain level, because that's what they've been taught and that's what they've been threatened to be forced into hospital and force fed. But they keep their weight just at the limit that they can stay out of hospital and they don't have any problems with the medical world. But they've been taught they will eat. So they now have a habit of eating, but they have still the problem at the back of their head that they don't want to get too fat, and too fat for them is over a BMI of about 16. Usually it's something like that. They're very, very, very thin. So what they do, they eat and then they compensate either by throwing up, often with sport. Now, sport is a compensation. I've had patients that have used sport as the compensation for overeating. I had a patient that totally damaged her knee joints because she had an apartment, a bike, and she would eat and eat and eat, and then she'd go on the bike, and then she would bike for hours and hours and hours. And eventually her knees started to become damaged. And the joints, you just keep doing the same thing, you keep rubbing them. Sooner or later, they don't cope anymore. So, and the other main way of losing weight, other than throwing up, laxatives, and sport, is fasting. And there are people that do this fasting, bulimic crisis, fasting, and they have a moment, then they eat normally, then they have a crisis, then they fast to lose the weight, and then they start. I mean, all these ways of compensating are horrible, are painful, or you could even say disgusting. And these people, they live with this as their daily lives. Maybe they don't have the bulimia crisis every day. They might have it once a week, maybe once a month. But just the same, it's something that haunts them. And what I feel is incredibly important is that we look at the root of what it is that troubles them. Is it anger? Is it loneliness? Is it trauma? Is it family problems from a long, long time ago? And if we don't dig in, if we don't find out what is the root cause of this, then you can never treat it appropriately. And you certainly can't treat it as bulimia, because it just doesn't make any sense. It's just a way of saying eating a lot and then compensating. That's all it means. It doesn't say anything about the real cause, the real root, or the real purpose of that behavior. That behavior has a sense. Every type of behavior, every type of functioning has a sense. Now, for us, hopefully us, not me, because I'm not normal, but for normal people, maybe the sense isn't there. I know, I mean, I don't know if I've said this in the English version or the French version. I keep saying that because I do the French version first, and I'll repeat the English version. Sometimes I forget totally if I've said it in the English version or the French version. But a part of my interest in eating disorders, especially bulimia, is because I'm slightly bulimic. I say slightly because I know how to use food as a compensation. I know food is important for my emotional well-being, and I know that if I feel particularly tired or I feel depressed, which happens from time to time, I don't allow myself to be depressed much, I don't like it much. I usually cope with that, but food can be a compensation short term. And if I've got a big job, if I'm going to really push myself to do to be at the computer for hours and hours and really get something done in a short space of time, then I use food as a fuel, and if I'm sick, I use it as a compensation. So I understand to have an emotional and physical need to eat maybe quite a large quantity. So I understand it. It doesn't mean that all cases are the same. So if you find yourself in this situation, or you know someone else that's in the situation where they have this cycle of eating too much and then doing something to lose the weight or compensate, then either dig in your own self, find a therapist, find an approach that helps you understand what it is that's happening within you, or if you know somebody that's close to you that's also experiencing and expressing an eating disorder. As they will talk about bulimia today, another day maybe if anybody's interested, we can talk about anorexia. It's the same sort of approach. It's the same. There are several different reasons why people are anorexic, so it's also something to keep an eye on and to be aware of it. So all anorexics are not the same either. Even the ones that are hypophagic, even the people that eat too much and become obese, it's not all the same reasons either. We're complex human beings. Life is multifactorial, and there are often different things that come into play for different reasons. Sometimes you have the same unhealthy behavior, but for different reasons. Why? Because the unhealthy behavior, like taking drugs or getting drunk or something, becomes the passport, becomes the passepartout, becomes the solution for different types of unwellnesses, of unhappinesses. You say, well, that works for that. I feel bad. I'll do the same thing, and I feel bad, and I'll do the same thing. So sometimes you get one type of problematic, one type of behavior, dysfunctional behavior, and maybe that dysfunctional behavior is there for different reasons, and you get used to using that, and then after that use it for all different problems that you have. So allow yourself, if you have an eating disorder, it's like anything else, but this is very specific because an eating disorder is an expression of unwellness. It is not a problem in itself. It's not a bad habit. It's not an addiction. It is an expression of unwellness. And if you have this sort of expression of unwellness, then please find someone that will help you to find out what that unwellness is and help you deal with that. And the eating disorder will, to a large degree, disappear by itself. There are certain practical things that one can do, and I'm not saying that those are not sometimes necessary or useful, but it's not really the basis of the therapy. Okay, so that's all for tonight. Tonight is Thursday night. This is the end of the 70-day challenge. Tomorrow I don't do YouTube. Saturday I am starting my holiday, and I actually take the keys to the apartment at 4 o'clock tomorrow. So I doubt very much if I can, on Saturday, so I doubt very much if I'm going to do a YouTube live on Saturday. Maybe I'll record something. We'll see. Sunday, it's already at the end. Maybe I'll do a guided meditation if I fancy on a day of my holidays. So we'll see. Other than that, as the summer is beginning, give this advert out, is that I have decided that I'll be available for one-to-one sessions on the internet. So if you or anybody you know would like a session with me, either 1 hour or 2 1 hour sessions, it's possible, and you're open to the fact that people get to see and share what your story is, I'll be open to that. Let me know, and we'll put something in place. Other than that, you can still you can still subscribe to the channel, share with other people, and hopefully I'll have something on Saturday. Bye for now.